Good morning. I think we will get started since it's 10:15. My name is Chandy John. I'm the past president of ASTMH, and it's my honor to introduce our speaker today, the director of the Peace Corps, Dr. Josephine or Jody Olsen. This year we had this unique opportunity, the opportunity to have the director of the Peace Corps come to speak to ASTMH members, and we immediately seized the opportunity because the missions of the two organizations in service to the poor and underserved, often in tropical areas, have a very clear overlap. Many ASTMH members are former Peace Corps volunteers, and this relates in part to this shared ethos. As the leader of the Peace Corps and a veteran official of this historic and respected organization of global volunteers, Dr. Jody Olsen has a unique view of the rise of interest in global health careers. Dr. Olsen was sworn in as the 20th director of the Peace Corps in 2018. She brings a wealth of Peace Corps experience to her goal, having served for over 16 years in various senior capacities in the agency. Most recently, Dr. Olsen spent 8 years as a visiting professor at the University of Maryland, Baltimore School of Social Work, and director of the university's Center for Global Education Initiatives. In this capacity, she developed and directed interprofessional global health projects for students in dentistry, law, medicine, nursing, pharmacy, and social works. The programs, primarily in Malawi, included maternal mortality, health care for orphans and vulnerable children, and health care for children at risk for malaria, all topics of great interest to society members. As a side note, highlighting some of the ASTMH connections, one person she told me she met there with weekly is our board member, Miriam Laufer. Our current president, Joel Bremen, told me that he considers his family a Peace Corps family because so many family members have worked in the Peace Corps. And our past president, Pat Walker, has a sister currently working in the Peace Corps in Uganda. So we have incredible connections here, and that's why you see people really interested in what you have to say, Dr. Olsen. Dr. Olsen's a native of Utah, received a bachelor's degree from the University of Utah, a master's degree in social work, and a PhD in human development from the University of Maryland, and an honorary doctorate from Michigan Tech University. It's a privilege to have her speak to us about the intersection of Peace Corps and ASTMH work, so please join me in welcoming Dr. Olsen.
Thank you, Dr. John. And there's a funny sense of this, of like coming home. Not that I've ever been to this conference before, but as I've been talking to people, all the connections, the people, how we all work together just creates a huge level of comfort. And I don't know if Miriam is in the audience right now, but Miriam Laufer was a real mentor to me, a real guide for me as I got more and more involved in global health. And I wanted to really acknowledge the extraordinary way that she mentors both faculty and students, including me. Thank you, Dr. Joel Bremen, who, as we noted, his son and daughter-in-law were both Peace Corps volunteers, and he worked with the medical side of Peace Corps volunteers in Burkina Faso. So almost everybody I turn to and talk to has a Peace Corps connection somewhere. I am so honored to be here today and to be speaking with you today, because you are the experts dedicated to reducing tropical infectious diseases and improving global health. Over the next 30 minutes, I will share how Peace Corps today is a vibrant international force promoting healthcare globally, and how our returned Peace Corps volunteers offer you a cadre of experienced health professionals to advance your mission. Let me take a risk here and have people raise their hands if they're former Peace Corps volunteers, former Peace Corps staff, and or families of Peace Corps. Oh my heavens. This really is family. I love it. I personally, as you could tell, feel a connection, as does the Peace Corps as an institution, with ASTMH and all of you, the professionals it represents. Today, Peace Corps has over 7,000 volunteers serving around the world, 20% of whom work directly in the health sector. You and Peace Corps volunteers share a commitment to improving the quality of life of people and communities throughout the world. We all work towards the same goals. Aha, it works. Peace Corps is an investment worth making. Its mission is still relevant today, as relevant as it was in 1961, 58 and a half years ago. Volunteers continue to make a difference in their communities, and return volunteers respond to the lifelong call, as you all in the audience know, to service with an immeasurable return on investment, both in countries and here in the U.S. Volunteers make a difference with some of the world's most vulnerable and other underserved communities. And returned Peace Corps volunteers, as I say, many of you, continue to change the world of public health long after the end of Peace Corps service. I became a public health wannabe when I was at Maryland, as I hung out with the public health faculty. Boy, did I hang out with them. I loved them. And made the social determinants of health the core of much of my teaching, even in social work. Prior to my tenure as Peace Corps director, I served on the faculty at the University of Maryland, Baltimore, where among other roles, I directed the interprofessional global health projects, working with Miriam Laufer in Malawi and then in many other countries around the world. This was an eye-opener for me, very, very important for me to appreciate the basics of health for all human life, dignity, and for families and communities. But let me go further by telling you how I got here now, not driving Interstate 295, but my path to service that began on the shores of Tunisia as a Peace Corps volunteer in 1966. I was 23 years old, a Peace Corps volunteer in Sousse, Tunisia, nestled along the coast of the Mediterranean Sea. I had a beautiful Peace Corps assignment. I was working in a maternity clinic in town. One late afternoon, I sat at the bedside of a young woman and her newborn twins. She sat on the hospital bed, one of her twins nestled in her arms. His twin lay at the foot of the bed, alone. After greeting her in a puzzled voice, I asked, "Why is this twin at the foot of the bed? Can I bring her to you?" "She is weaker," the young mother replied. "I don't have enough milk, and we don't have enough food for both." Her reply was direct, and what felt to me at the time void of emotion. I responded with silence. It was that day, at that bedside, that I learned that patient behavior, patient decisions move in tandem with healthcare and delivery, and that I knew almost nothing about the whys of these behaviors. It was that day that I learned how language, culture, beliefs, and economics all affect health outcomes. It changed me forever. Who are we? The mission is still relevant. At the time of Peace Corps' creation, it presented a model for overseas service and global engagement that was unique and unprecedented. Many said, it will never work. It can't be done. But the first director, Sarge Shriver, brother-in-law of President Kennedy, knew that it could be done. The idea of the Peace Corps, the idea that volunteers could serve their country in the cause of peace by living and working in other countries, struck a chord with thousands of young people in the early 60s, and that enthusiasm continues today, and I feel it here. Since 1961, nearly 250,000 Peace Corps volunteers have served in 142 countries, tackling issues from public health to food security to environmental protection, and fostering the next generation of entrepreneurs in countries where they serve. The Peace Corps mission is to promote world peace and friendship through 3 important and interlocking goals: helping people of interested countries in meeting their needs for trained men and women, helping promote a better understanding of Americans on the part of peoples served, helping promote a better understanding of other peoples on the part of Americans. And as you see with that, it's both being present, being who we are with each other, and providing technical skills back and forth. While much has changed since Peace Corps' founding, our mission to promote world peace and friendship has not changed, nor have our 3 goals towards that mission. That is what makes us so strong today. Volunteers currently live and work in 62 countries. They serve alongside individuals and communities, collaborating with local governments, schools, small businesses, and entrepreneurs to create sustainable, community-based projects that address local development priorities across 6 sectors: education, health, youth development, community and economic development, environment, and agriculture. In addition to the traditional 2-year volunteer program, we have a program called Peace Corps Response, and be extra attentive when I talk about this program, which offers opportunity for experienced professionals to undertake shorter-term, 3-month to a year, high-impact service assignments, many of which are health-related and for health professionals. For those interested, I brought along our Peace Corps Response recruiter, Roberto Ugarte, with me, and I encourage you to talk to him outside. Wait till I finish, but afterward, you can go talk to him, or check out the openings on our Peace Corps website. 3 months to 12 months. You can say goodbye to your family long enough to do one of those Peace Corps Response programs. Just don't tell your family where you're going. Peace Corps and global health. Earlier, I mentioned that our volunteers serve in one of 6 sectors. And among these 7,000 plus volunteers, 1,500 of them work in the health sector. 1,500. And because health is so cross-cutting, volunteers with primary assignments in other sectors often implement initiatives that contribute to community health. Education volunteers introducing sanitation messages in their English classes, or agriculture volunteers collaborating with farmers to mitigate the health risks of pesticide use. One could say that Peace Corps volunteers embrace a One Health approach. We're on it. Across the globe, Peace Corps volunteers work in remote, underserved communities at what public health and international development experts describe as that last mile, where traditional aid and development programs most frequently falter or break down. We always think of that last mile. It's when we couldn't quite get the supply chain to the end of the road, for example. Volunteers don't just go the distance. They stay living and working side by side with those they serve for 2 years. But don't forget Peace Corps Response, that's 3 to 12 months, but we're talking about the 2-year volunteers now. They develop close partnerships with local counterparts. They drink tea with their elders, form friendships with their neighbors, colleagues, and host families. They learn to see the world through the eyes of the community. In the process, volunteers gain a firsthand understanding of the social determinants of health that influence daily behaviors in their communities. In the area of maternal, newborn, and child health volunteers, work with communities to end preventable child and maternal deaths by co-facilitating groups to promote comprehensive antenatal clinic visits among pregnant women to increase healthy pregnancy, safe delivery, and healthy newborns. Groups of mothers and caregivers to keep children under 5 healthy through promotion of good nutrition, malaria prevention, and improved hygiene practices. Training to build capacity of community health workers' skills in behavior change communication. And the behavior change communication is really key to the work of Peace Corps volunteers. Last year, nearly 200 volunteers reached over 18,000 individuals in small group education sessions on maternal and newborn care services. In the area of HIV/AIDS, health volunteers work to decrease HIV transmission by partnering with community members to co-facilitate sessions with health service providers, school staff, adult community members affected by HIV to educate on HIV prevention, medical services, and stigma. Caregiving support groups for orphans and vulnerable children and caregivers. Building clinic staff capacity to improve supply chain management systems. Volunteers have also worked on efforts to eliminate neglected tropical diseases, or NTDs, which I know is a very important part of the association work. Like trachoma in Ethiopia, where a Peace Corps volunteer developed a dissemination system at her local health center during the community's annual NTD treatment campaign that was later replicated for other important health interventions. Since launching the Stop Out Malaria program in Africa in 2011, we have trained and sent over 800 specialized malaria prevention volunteers, 800, to serve in communities across Africa. Last year alone, over 40,000 insecticide-treated nets were distributed by Peace Corps volunteers, and more than 100,000 community members were reached with prevention messages. Our volunteers in sub-Saharan Africa make an immediate and measurable impact in the fight against malaria. And a second shout out to Miriam Laufer, who has been on that research team for so many years. Just this September, I saw this work firsthand at a grassroots soccer camp in Uganda. I watched teenagers communicate positive health behavior through games, activities, and role play. 4 volunteers, Nicholas, Connor, Kayla, and Sadia, were hosting a one-day event about malaria control and prevention and HIV prevention training. They used an evidence-based curriculum by Grassroots Soccer, a South African organization that partners with Peace Corps. One of the volunteers, Kayla, grew up in Peachtree City, Georgia. She earned her bachelor's degree in global health with a double minor in global development and history studies, and then decided to join the Peace Corps. As a health volunteer in Uganda, she served as the co-coordinator of her local youth center, promoting HIV prevention and treatment within her district. She works with adolescent girls and women, implementing programs such as Grassroots Soccer and DREAMS as part of the PEPFAR program with local counterparts. It was a hot and sunny afternoon, as you can see, in a field in rural Uganda. The students gathered under white tents, a reprieve from the beating sun. Kayla and Joseph occupied the furthest tent at the back of the field, gathered with the older students to focus on the HIV curricula. See the tent? Kayla and Joshua connected with the students, incorporating their evidence-based practices and exercises from the curriculum, and brought energy, and you can see that energy, that inspired students to demonstrate to each other disease prevention and health promotion through their action, activity, and role play. They even had me, stuffy old me, they even had me kicking the soccer ball. The ball represented the person, and I and the kids had to kick it through cones, representing the risk factors for HIV transmission. Cones representing multiple concurrent partners, unprotected sex, abstinence abuse, and older partners. I felt such pressure to not hit any of those cones, which represented those bad things that happen. Kayla is just one of the nearly 50 volunteers in Uganda doing similar activities throughout the country. In addition to the health-focused work done by our 2-year volunteers, this year, Peace Corps Response, remember that term? Established a new program called Advancing Health Professionals, or AHP. Response volunteers, remember that's 3 to 12 months, serving with the AHP program, seek to improve health outcomes on a societal level through the provision of high-level specialized service in the health sector. AHP projects include nursing education, health system strengthening, service delivery improvements, and other non-clinical interventions which enhance the quality of health care. AHP is currently active in Liberia, Eswatini, Malawi, Tanzania, and Uganda. Applications are open now for departures towards the end of next summer. So you've got time to talk your family into this. In addition to placing nurse educators in the communities, this new program encourages innovative programming that improves the operational capacity of healthcare providers through teaching, training, and mentoring. In the coming year, more positions will become available that will recruit people with backgrounds in logistics, operations, and business processes who can help to refine the way the healthcare systems are managed overseas. Consider applying. Boy, am I subtle. Today, we face many of the same challenges and opportunities as those in Peace Corps' early years. We also face new challenges, including a changing technology and communication landscape, and ever-changing political and safety and security environments. Peace Corps' approach to development is to help people develop the capacity to use their own resources and skills to resolve their needs and improve their own lives. We become a catalyst for facilitating positive change through using people-centered approaches, emphasizing the process as much as the outcome, having recipients define their own development agenda. They're the ones that own it. Emphasizing a long-term vision, giving everyone a voice, building capacity, and making the outcome sustainable. These changes have included increased focus on programming and training, the development of the Peace Corps logic model frameworks across our sectors, and increasing our emphasis on monitoring and evaluation of volunteer work. And take special note of M&E plan, and with our M&E plan, our data. And this is very important for us now working in international development. We are able to be a more effective partner with other government and global non-government organizations, such as PEPFAR, the President's Emergency Plan for AIDS Relief, with PMI, the President's Malaria Initiative, and USAID's Envision project to fight NTDs. We're partners, and we can be partners because of our logical project framework and how we work and link with these other agencies and international organizations. It has been our work with PEPFAR that pushed us to more rigorous monitoring and evaluation projects, so I have a thank you to PEPFAR. Those who served over a decade ago might be surprised and certainly pleased by our new and refined programming, monitoring, and evaluation advances. All of the work done by people in this room provides guidance, data, and information used by Peace Corps volunteers to do their work. And now our volunteers' data help provide community-level information that supports your programs to reduce morbidity and mortality associated with preventable infectious diseases. We're part of that international development team. In fact, to demonstrate it, we have two recently returned Peace Corps volunteers here with us today. Happy Awid, who returned Saturday from Benin. Saturday. And Belen Gadines, who returned from Madagascar in July. And why are they here? In fact, Happy cheated and came back a few days early, just for this convention. Happy is a Togolese American, yay, Togo, who grew up in the Washington, D.C. area. She studied human services and social justice with a minor in public health at George Washington University. Shortly after her studies, she decided to explore her passion for global public health and serve as a health volunteer in Benin for 3 years, focusing on maternal and child health. During her first 2 years of service in the north of Benin, she led behavior change communication activities on malaria prevention, reproductive health, nutrition, and hygiene with women, as well as the youth of her community. She collaborated with skilled professionals in the city to provide income generation skills for women in her town. Boy, did you work hard. As a Peace Corps volunteer in Benin, Happy's work focused on a wide range of public health interventions, but one of her proudest accomplishments during her service was piloting a malaria case detection and management, PROACT, approach in 8 villages to reduce barriers in early care seeking for malaria. Through the project, she trained 14 community health workers to conduct weekly household visits to test and treat symptomatic children ages 6 to 59 months. During the 3-month implementation period, her team of 14 community health workers were able to detect and treat 658 cases of malaria in her town, significantly reducing the burden of illness for the families and the entire community. Having recently completed her Peace Corps service as of last Saturday, Happy is eager to pursue and continue to contribute to the public health field. And she presented a poster here on Friday. She competed and won that opportunity to present a poster titled Proactive Community Case Management of Malaria in Children aged 6 to 59 months, results of a pilot project in northern Benin. And here is her poster. I hope you had a chance to stop by. If not, she's here to share her experiences after this session. Belen Gadines is a recent RPCV from Madagascar, where she served from 2016 until this last July. Originally from Los Angeles, she earned her Bachelor of Arts in Sociology and Chicano Studies at the University of California, Santa Barbara. Throughout college, Belen was eager to be in service internationally, but it was her experience to study abroad in Thailand and Ghana, where she volunteered conducting health sessions to students and community members. Following her passion for service and public health, she joined the Peace Corps in 2016. In Madagascar, she served as a community health advisor for 2 years and extended her service for a 3rd year as the President's Malaria Initiative Coordinator with Peace Corps Madagascar. On Friday, Belen presented a poster. Also, she sent it in, competed, and won the chance to show her poster here. Effectiveness of Malaria Boot Camp Training, equipping Peace Corps volunteers and their counterparts to implement malaria prevention activities in rural Madagascar. Like Happy and Belen, who will be going to pursue an MPH this coming year and will continue to share their experiences with you after this session. I congratulate you both that you're right there moving into public health. While Peace Corps volunteers like Happy and Belen live and work in the communities where they serve, they learn the language, eat the food, experience the culture. Through integration into their communities, they work towards sustainable and positive change on the lives long after their service. This is what sustainability is about. Peace Corps, as a call to lifelong service, is not new, but we instill this commitment into each new Peace Corps volunteer and into our returned Peace Corps volunteer community, many of whom are right here. We do so by recognizing returned Peace Corps volunteers and their contributions, who have skillfully taken their Peace Corps experiences to organizations, communities, and people throughout the U.S. and abroad. But Peace Corps volunteers also gather skills during their service, and they carry them with them into careers in public health, monitoring and evaluation, grant writing, health education facilitation for disease prevention and health promotion, just to name a few. I wanted to mention a program that we have with universities for returned Peace Corps volunteers. They take advantage of our Peace Corps Coverdale Fellow Program. This program is a graduate school benefit program that provides financial assistance to return volunteers who satisfactorily complete Peace Corps service. All fellows complete internships in underserved communities in the United States, allowing them to bring home and expand upon the skills they learned as Peace Corps volunteers. These skills in adapting to new cultures, developing and managing projects, dealing with language barriers, and leveraging limited resources attract the attention of prospective schools. Since the inception of the Peace Corps Fellows, the Coverdale Fellows program, more than 5,000 returned volunteers have participated and made a difference across the country. The over 100 participating universities have contributed over $11 million in tuition for these graduate students just this last year. Universities believe in returned Peace Corps volunteers. And among these universities, we have 42 public health programs and 10 nursing or medicine programs which partner with us in recognizing these contributions. Not to advertise, but the University of Maryland School of Social Work and School of Nursing have these Coverdale Fellows programs. And what's exciting is that they have now brought them together into one Peace Corps Fellows program at the university. This last April, I visited the Coverdale Fellows program, Coverdale Fellows, in the Masters of Public Health program at Johns Hopkins Bloomberg School of Public Health. Faculty described the value of the program to the university, and the fellows themselves talked of how their Peace Corps service has influenced their graduate work. One fellow came up to me during our discussion and said specifically, it was my being part of the Logic Project framework in my site with my counterparts that brought me here, and that's exactly what they're teaching here now at Johns Hopkins. I feel so prepared. I know that you too, Happy and Belen, will offer a lot to the MPH programs that you're about to enter. I have visited health organizations around the world. This month alone, I have visited the National Institute of Health, U.S. Agency for International Development, the President's Emergency Plan for AIDS Relief, the Health Resources and Services Administration, and the President's Malaria Initiative, all, of course, who are here today, where I find amazing professionals who begin their journeys as Peace Corps volunteers. It kind of sounds like I have a bias towards health programs and health-related agencies. I recently had a conversation with a returned Peace Corps Senegal volunteer, Julie. Julie now works at the President's Malaria Initiative here in Washington. When she applied to the Peace Corps, she was an RN working at a hospital, but she wanted international experience. She had a mentor who was one of the first Peace Corps volunteers in the 60s, which is a reminder that you also can be mentors to young people. And after her mentorship conversation, she sought that experience. Julie shared with me how the skills she learned in her service are so valuable today. She said, I recognize that everyone wants what is best for their families and their communities. Through this, I gained a new perspective that orients how I think about approaching and solving problems. The essence of the problem isn't on the surface. It's deeper. And the cross-cultural perspective is essential to solving it. Earlier this week, ASTMH CEO Karen Grozowski shared a quote by Leo Su. Go to the people, live among them, love them, listen to them, learn from them, begin with what they know, build on what they have. RPCV Burkina Faso Dr. Jonathan Schultz reflected on this quote, noting the relevance and importance of this sentiment in all our work in international health research and health system strengthening. This quote, and it's why I'm bringing it back right now, could describe the Peace Corps. This is why we really are part of the international development family together. How to engage? I certainly haven't given you any ideas yet, but I'm going to now. Peace Corps is an investment worth making. We're relevant. We make a difference every day. Like Happy and Belen as volunteers, like Julie as returned Peace Corps volunteer. We have a collective duty to continue the legacy of service. First, we continue that service by, we continue the legacy by serving, choosing to serve. Very important. Second, we continue the legacy by inspiring others to serve. Our Refer a Friend initiative is a referral system to help you reach out to the next generation of Peace Corps volunteers. Your recommendation is of such value to future volunteers. So here's how you do it. peacecorps.gov refer, and learn more and refer a friend. We will pick up at that point. Third, we continue the legacy of service by telling our stories and acknowledging the experiences of our returned Peace Corps volunteers. And you were wonderful this morning before I came up here to tell me your stories. I love your stories. And you can take it a step farther. If there's something you want to share as a story, our Director of Communications, Matt Sheehy, is in the back. See, we come prepared. And you can talk to him about a story, or you can go to peacecorps.gov/stories, and there's a section where you can submit your story and then work with our team to have it published on our website. We love publishing your stories on our website. This is where inspiration for the next generation begins. And if you're not a returned Peace Corps volunteer, chances are you know one, or that you employ one. Create opportunities for returned volunteers to share their experiences with you to continue the Peace Corps' third goal. This means non-competitive eligibility. If you're with a federal agency, you can sneak returned Peace Corps volunteers into your agency quickly and easily. And the HR department can help figure that out. They're good at this. And if and as you work at universities, at international NGOs or organizations, look seriously at hiring returned Peace Corps volunteers. You saw all the ways that they are so prepared for the work that you do. As I said earlier, I have shared that Peace Corps today is a vibrant international force promoting healthcare, and our returned volunteers offer you a cadre of experienced health professionals to advance your mission. As I conclude, I want to take you all back to that maternity ward in Tunisia, where a young mother made what she thought was her only choice, the choice to end the life of one to save another. Now pause and reflect on a moment that inspired you to seek and pursue your own path of service in public health. What was that moment? What was that moment? It is through creating opportunities for others to learn, to experience, to have empathy and understanding for others that we shape the next generation of public health professionals and continue to improve health outcomes for generations to come. Thank you very much.
Thank you so much, Dr. Olsen. Before we close this session, I want to reflect a little bit. The quote you put up was put up by Dr. Abhay Bang, who was our first keynote speaker, and it is so wonderful to go from beginning, middle, and end of session. We had Dr. Francis Collins, Dr. Abhay Bang, and now you talking about research, clinical care, and public health, not of or on the people, but with the people. Our other keynote speaker was Dr. Rani Bang, and her point was to listen to the women. We just listened to you, your Peace Corps volunteers, and maybe most importantly, the women in the areas you serve. And I want to say a personal thank you to the women every smart ASTMH president listens to, which is Karen Goraleski, our CEO. It was her idea to bring you here, and I'm so glad you were able to come here. So on behalf of ASTMH, I want to present you with this plaque to thank you so much for your work and for coming here to talk to us. Thank you. That closes the session. Thank you.
electrophoresis, like chemistry, as well as the
And if
baths,
you want
fresh.
to take up, leading ones and those and other ones,
See, these are the periodic table. It's taken from the joints. This is nobody knows about it. It's plastic in the bedrooms.
so is the Sahel temperature particularly suited for them?
Yeah, because it's 50 degrees Celsius. Yeah, so this is what I usually do for the civilians, and they like it a lot. So the spiders to use it. So is this industry?
Developing a simple